So most patients are very interested in what happens after knee surgery and what are the milestones I can expect to get back to my normal life. So in the hospital or in the surgery center, once the knee replacement is done, typically the patient will start to walk on a walker for the first 1 to 2 weeks. And we basically have patients use a walker or crutches until they feel like they're confident and comfortable without that. So they'll typically start grabbing the furniture or the wall and walking that way after about 5, 6, 7 days. And usually by the time we see a patient back in our office at the 2-week mark for their first postoperative check, they're usually off the walker or off the crutches, or maybe using a cane or using the walker or crutches for very long distances. But for the most part, they're walking on their own at that point. As far as driving goes, if it's your right knee that we're operating on, typically it takes about 4 weeks for most patients to be able to drive and push safely on the gas and the brake in an emergency. If it's your left knee and you have an automatic transmission car, then typically you can start to drive as soon as you're off your pain medications, which is usually about between 5 and 7 days post-surgery. As far as going back to work, it depends upon your job. If you can work from home, most patients can start to work at about the 2-week mark, but they want to probably limit their schedule a little bit because you're going to feel tired. There's a lot of energy involved in healing this, and you'll find you just run out of energy at about 2 o'clock in the afternoon and want to take a nap. And so make sure that you schedule yourself in a way that doesn't really demand that you're present all day long, even if you're working from home. As far as working at the job site, if you have a sit-down job, probably about 4 weeks post-surgery is a reasonable amount for most patients, especially if you have to drive and you're using your right leg, like we said earlier. If you have to do a lot of walking at work, then probably between 6 and 8 weeks is a more reasonable expectation, because you want to have that energy back and you want to have the ability to walk comfortably and feel like your strength is back in your knee. And that takes about 6 to 8 weeks for the average patient. People want to know when they can go back to playing golf. About 3 months for the average patient to walk the course and feel comfortable on 18 holes. You can go back at the 2 to 3 month mark with working on your short game and working on the driving range, that sort of thing. But as far as actually getting out and walking the course, 3 months seems like a pretty good average. As far as travel goes, it depends upon the type of travel. Some patients will fly to Seattle to have us operate on them here in Seattle and then fly back to Alaska or Montana or California a week or so later. And that's fine to do, but it's not very comfortable, but it can be done. For travel where you're going to go and actually have fun and want to see somebody and feel like your knee can support you and you can walk and explore and things, probably a minimum of 6 weeks and more likely 3 months before you really want to take that trip of a lifetime sort of thing. Full recovery until most patients feel great and they feel like the surgery's behind them and they're on to the next thing in life is somewhere typically between 4 and 6 months for the average patient. Some people are lucky and feel that way at 3 months out, and some people take longer and take a year. But for most patients, somewhere between 4 and 6 months is a good estimate for being back to full fighting strength.